My name is Felix Mahfoud. I'm professor of medicine and a cardiologist working at Hamburg, Saar, Germany.
Thank you very much.
Well, we all know that high blood pressure is worldwide risk factor #1. And despite the availability of safe and effective antihypertensive drugs and lifestyle modification, many patients remain uncontrolled. So there is an unmet need for additional treatment approaches to lower blood pressure in hypertensive patients. And the SPYRAL HTN-ON study investigated catheter-based renal denervation in uncontrolled hypertensive individuals treated with 1, 2, or 3 antihypertensive drugs. This study included patients with uncontrolled hypertension. Office blood pressure was in between 150 to 180. Ambulatory blood pressure was in between 140 to 170. And patients were treated with guideline-recommended drug therapy. Indeed, they received 1, 2, or 3 antihypertensive drugs. And despite the intake of these drugs, they were uncontrolled. We randomized these patients to an invasive placebo, a sham, and renal denervation using a radiofrequency catheter. And we followed these patients out to 3 years. So first, we showed a continued and progressive decline in blood pressure over time. Ambulatory blood pressure was reduced up to 19 millimeters of mercury at 36 months of follow-up, and that was significantly larger as compared to the sham group. Although medication was no different between the two groups, when you carefully look into it, you'll appreciate that the sham group numerically received more drugs, although their blood pressure lowering was less pronounced than in the denervation group. And that adds to the knowledge of renal denervation that indeed, in combination with antihypertensive agents, you can appreciate a significant reduction in blood pressure. This is another piece of the puzzle, right? Adding to the evidence that renal denervation effectively and safely lowers blood pressure in hypertensive patients. We have documented this in patients without concomitant antihypertensive drugs. We have seen it in patients with antihypertensive agents, 1, 2, or 3, and even on a triple fixed combination. And we have a large cohort of patients being treated in a registry, so 3,000 patients. And again, this is a piece of the puzzle showing that in a sham-controlled fashion, you appreciate a sustained reduction in blood pressure, even a progressive reduction in blood pressure out to 3 years, and that speaks to the relevance of the sympathetic nerves and the capability of renal denervation to lower blood pressure even over time. There is an extension to that SPYRAL HTN-ON study ongoing with another 260 patients being randomized, and other continued access program trials are ongoing, registries are ongoing, and these will complement the evidence. I think we have achieved a significant, and we have acquired a significant body of evidence indicating that it is efficacious and safe in lowering blood pressure, and that this is an attractive and alternative treatment option in patients with hypertension. So this is an important piece of evidence because it shows in a sham-controlled fashion that denervation can lower blood pressure out to 3 years. So there is no indication of reinnervation of sympathetic nerves, functional reinnervation of sympathetic nerves. And it also shows that when you add denervation to medication, you can appreciate really significant and clinically meaningful reductions in blood pressure. As said, 20 millimeters of mercury reduction. That's a really important number that is relevant for patient care.